heart is a pump that relies on precise valves to keep blood flowing in the right direction. But when one of these gates fails, the entire engine is compromised. Today, we visualize the intricate mechanical solution used to replace a failing aortic valve, restoring the rhythm of life with engineering precision. The problem typically occurs in the aortic valve, the main gateway between the heart and the rest of the body. Over a lifetime, calcium deposits can build up on the delicate leaflets. This condition, known as aortic stenosis, turns soft tissue into hard stone, narrowing the opening and preventing the valve from opening fully. From inside the aorta, we can see the struggle. The heart muscle must pump with immense force to push blood through this tiny, calcified slit. This creates a high-pressure jet of turbulent blood, putting dangerous strain on the heart walls and thickening the muscle as it fights against the blockage. To measure the severity of this restriction, doctors use an echocardiogram. By tracking the blood flow with color Doppler technology, the turbulence lights up on the screen. This allows the surgical team to calculate the pressure gradient and confirm that a replacement is necessary to save the heart. In the operating room, the environment is meticulously controlled. The patient is prepped with antiseptic, and the surgical field is draped in sterile blue. Every instrument is laid out, ready for a procedure where every second and every millimeter counts. Because surgeons cannot operate on a moving target, the heart must be stopped. Tubes are connected to the major vessels, diverting blood to a heart-lung machine. This external pump takes over the job of breathing and circulating oxygenated blood, keeping the patient alive while the heart is paused. A specialized fluid called cardioplegia is injected into the coronary arteries. Almost instantly, the electrical signals cease. The heart slows, flutters, and comes to a complete, peaceful stop. It is now a still, motionless canvas for the surgeon's work. The removal process requires patience. Using surgical scissors, the diseased leaflets are carefully cut away. The surgeon then scrapes the rim of the valve, known as the annulus, to remove any remaining calcium deposits, creating a clean, smooth ring of tissue. To ensure a perfect fit, a sizing tool is inserted into the empty ring. The surgeon tests different diameters to select the exact size of the mechanical valve implant that matches the patient's anatomy. The implantation uses a parachute technique. Strong sutures are stitched first through the heart tissue and then through the sewing cuff of the mechanical valve, which is suspended outside the chest. The threads connect the biology to the machine like the lines of a parachute. The valve is then gently lowered down the guide strings until it sits flush against the heart's natural ring. The surgeon ties down each suture individually, locking the processes firmly into place to ensure there are absolutely no leaks around the edges. The window in the aorta is now closed. The arterial wall is stitched back together with a continuous, watertight suture line. The seal is checked, and the heart is ready to be brought back online. The cross clamp is removed, allowing blood to fill the heart again. As the tissue warms, a single electrical shock is delivered. The heart jolts once and immediately snaps back into a strong, rhythmic beat, now pumping through a brand new gate. Inside the vessel, the mechanical efficiency is visible. The beat leaflet carbon valve opens freely to let blood pass without resistance and snaps shut instantly to prevent backflow. The turbulence is gone, and the flow is smooth and laminar. To finish, the breastbone is brought back together. Stainless steel wires are threaded through the sternum and twisted tight, creating a rigid fixation that will allow the bone to heal back into a solid shield. Recovery restores not just health but vitality. With the obstruction removed, the patient returns to an active life. The mechanical valve clicks softly and reliably, a durable engine part that will keep the blood flowing for decades to come. Heart valve replacement is a triumph of bioengineering, merging human anatomy with mechanical perfection. Thank you for watching this visualization. For more deep dives into medical science, subscribe to Surgery Visualized.